Today, we're fortunate to have some highly knowledgeable and diverse group of witnesses. They're going to be sharing their testimony and their knowledge, their experiences with us today. And it's my hope that we'll be able to take all of this expertise presented today to use it as a basis to shape further conversations on affordable and accessible residential opportunities for people with disabilities. I want to take a moment to express my appreciation for the members that are here today of the committee, members of the disability community who are continuing to advocate for quality of life that every person with disabilities deserves. I look forward to hearing from everyone, working together to ensure that we address this issue and that we continue to provide those opportunities to access housing that people deserve.
Housing is more than just a roof over someone's head. It is the foundation for independence, dignity, and stability. We must ensure that our housing policies support inclusive options that promote both autonomy and safety.
My name is Nick Cappoletti. First and foremost, I identify as a parent of a child with a developmental disability. So I'm appearing before you as a parent, a provider, somebody who cares very deeply about policy, and also cares very deeply about the unmet need that exists in the community. The current reality is we have 130,000 people in the OPWDD system. 35,000, as Winnie said, live in certified residential settings. But we have over 95,000 people currently living in the community, either by themselves or with family members. And of those, 40% of those individuals are medically and behaviorally complex. There are now more than 22,000 people collectively represented in the 7 CCOs who are seeking OPWDD eligibility. So there's a huge unmet need. In addition, New York State Department of Health, through the 1115 waiver, has estimated that there are over 200,000 people with an IDD diagnosis currently on Medicaid that aren't even part of the OPWDD system. Given these facts, we need to ensure that our system plans for and implements meaningful expansion of residential opportunities as soon as possible. We currently have over 30,000 people living with aging caregivers. And of the new people that are coming into the system, over 60% actually have a comorbid mental health issue. And as they age, their needs level gets more complex, more medical complexity, more behavioral complexity. And we have to prepare for that. We can't afford to build tens of thousands new group homes. We have to think innovatively and think of ways to support people living in the community. Few key recommendations: expand and diversify the current supply and portfolio of residential options. We've done very little to really create scalable, long-term, non-certified opportunities. We have to reduce some of the regulatory barriers that restrict innovation. One example is the Nurse Practices Act, which restricts the ability for DSPs to be able to give people medication in non-certified settings. That is a major hindrance to us being able to develop non-certified residential opportunities. In the OPWDD system, we've moved to where we have some options for those people who are highly capable and independent, and then we have some certified options, which may still need lots of work, for those people who need more intense services. But what's in between? There's not a lot of options. And that's the big challenge, because again, with 95,000 people, can we afford to move everybody into the certified? We can't. You have to look at the whole population and what their needs are, because we have people who are literally living in hospitals for 18 months, 2 years, because of their unmet healthcare needs. Or if their healthcare needs are met, we can't get them into the appropriate long-term support setting.